Today, we're jumping into a really complex and honestly often misunderstood topic in psychology, conduct disorder. You know, it's a question that so many of us have probably thought about. All kids push boundaries and break rules sometimes, right? But when does that typical acting out actually cross the line into something that might need a clinical diagnosis? Well, that's exactly the question we're going to unpack today.
So here's our roadmap. We're going to start with what conduct disorder actually is. Then we'll break down the 4 main types of behaviors. After that, we'll add some really important nuance, look at where it comes from, and wrap up with why all of this matters in the long run. Let's get started.
All right, first things first. What exactly are we talking about when we say conduct disorder? Let's get a clear definition. Okay, so here's the core of it, straight from the Diagnostic manual. Now, the 2 words you really want to hang on to here are repetitive and persistent. This is not about a one-time mistake or a brief rebellious phase. We're talking about a consistent, ongoing pattern of behavior that seriously infringes on other people's rights or breaks major social rules. And it's so important to get this. This isn't just a vague label. It's a diagnosis with a really specific clinical threshold. A clinician has to identify at least 3 specific behaviors from a list of 15, and those have to have happened in the last year, with at least 1 showing up in the last 6 months. So, yeah, it's a pretty high bar to meet.
Now, a list of 15 different criteria can feel like a lot to take in, right? But thankfully, it's really helpful to group them into 4 main categories. This really helps paint a much clearer picture of what's going on.
These are basically the 4 pillars of the diagnosis. Pretty much any behavior that qualifies for conduct disorder is going to fall into one of these buckets. So let's dive into each one and look at some real-world examples.
The first category is often the most jarring. This is all about aggressive behavior that either causes or threatens real physical harm. We're talking about things like a consistent pattern of bullying or intimidating others, actively starting physical fights, using a weapon, or even being physically cruel to people or animals.
Okay, the second category kind of shifts the focus from harming living things to harming property. And the key word here is deliberately. This isn't accidental. It includes behaviors like intentionally setting fires with the goal of causing serious damage, or other forms of vandalism, smashing things, destroying property that isn't theirs. Third up, we have a pattern of deceitfulness or theft. This can be something as serious as breaking and entering, but it also covers things like constantly lying to get something or to get out of trouble, what the manual actually calls conning others. It also includes things like shoplifting or stealing without any direct confrontation.
And finally, our 4th category covers really serious rule breaking, especially for someone's age. This means behaviors like, for a kid who's not even 13 yet, frequently staying out all night against their parents' rules, running away from home for a night or longer, or constantly skipping school.
But here's the thing. Conduct disorder isn't a one-size-fits-all diagnosis. Not at all. There are some really important specifiers that add critical layers of nuance and help us understand the situation better.
A huge distinction a clinician will make is when the symptoms first started, because the difference is pretty stark. If at least one symptom shows up before age 10, that's called childhood-onset. This type tends to be more common in boys, is often linked with really troubled friendships, and unfortunately, usually points to a tougher long-term outlook. On the other hand, there's adolescent-onset, where no symptoms pop up before age 10. This is often linked with more typical peer groups and is less likely to continue into adulthood.
And beyond just the age it starts, there's another crucial layer. For some individuals, a clinician can add this specifier with limited prosocial emotions. You'll often hear this talked about in research as callous-and-unemotional traits, and it points to a very distinct psychological profile.
So, what does that actually look like? Well, this specifier gets added when a person persistently shows at least 2 of these 4 traits. This could be a real lack of guilt after they do something wrong, a callous lack of empathy for other people's feelings, being totally unconcerned about performing poorly at school or work, and showing emotions that just seem really shallow or just being used to manipulate someone. So you might be wondering, how common is this disorder really? And what are the things that might put someone more at risk for developing it?
Well, in places like the US, the numbers can range from about 2% to over 10%.
but the median number usually lands right around 4%. To put that into perspective for you, in a typical high school with, say, 1,000 students, you might expect about 40 of them to meet the criteria in any given year.
And that difference becomes even more clear when you look at the chance of being diagnosed at any point in life. For men, the rate is about 12%, while for women, it's closer to 7%.
You know, when it comes to a cause, there's just no single answer. It's always a really complex mix. You've got temperamental factors like having a difficult temperament as a baby. Then you have huge environmental factors, things like parental neglect, really harsh discipline, or being rejected by friends. And on top of all that, there are genetic and physiological factors, like a family history of the disorder, or even, as some interesting research has found, a slower resting heart rate.
Okay, so this brings us to our final and maybe our most important section. Why is it so absolutely critical to understand and identify this disorder? Well, it's because the long-term consequences can be really, really severe.
The behaviors that are part of conduct disorder can set off a whole cascade of negative outcomes. We're talking about everything from getting suspended or expelled from school to running into legal trouble, to an earlier start with substance use. It also raises the risk of physical injuries from fights or accidents, and even points to more health problems later in life. And here is a super important takeaway. For most people, the disorder does get better or even go away by the time they reach adulthood. But, and this is a big but, that childhood onset type we talked about earlier carries a much higher risk. It's more likely to stick around, and it can increase the risk for an adult diagnosis of antisocial personality disorder.
So, we'll end on this question. It really challenges all of us to think beyond just putting a label on difficult behavior. How can we use this deep clinical knowledge to actually figure out who is struggling and why they're struggling so that we can build better, more effective, and more compassionate support systems for them and for their families?